Hi, everyone. This is Dr. Clark. So tonight I'm going to be talking about optimizing fertility, naturopathic approaches to preconception care. So what inspired this webinar was that it is National Infertility Awareness Week. And so I'm going to actually start off with a few statistics on the next slide here. 15% of couples have difficulty conceiving after 1 year of trying, which is what is considered infertility, which is a pretty high number. And in the United States, 12% of women of childbearing age have used an infertility service. So they might have sought help and maybe pursued IUI or IVF, which are two of the most common fertility treatments. And overall, infertility rates have increased. So over 1990 to 2017, it was by about 15%. Other studies have looked at infertility rates over 50 years by decreasing by almost 50% by some accounts. So chances are, you know, people who have struggled with infertility. It is very common. A lot of people keep it to themselves. So you may not know that people you know have been struggling with that, but it is very common. And so, one of my goals as a naturopathic doctor is to determine how naturopathic medicine can help optimize preconception care, whether that is with assisted reproductive technologies, meaning you've already kind of been dealing with infertility and we're trying to optimize egg quality or embryo quality or sperm quality. Or if you are newer and just kind of thinking about maybe conceiving in the next year, there's a lot that we can do. So tonight, I'm going to walk through the following agenda: cycle tracking and timing, nutrition and supplements, environmental or lifestyle considerations, a few extra notes on men's fertility, though I touch on that throughout, and labs and imaging. I think the whole presentation should take close to an hour. I'll try to keep it brief as I can, but just so you have a ballpark time frame. All right, so the menstrual cycle. We can't really move forward until we know what we're dealing with the menstrual cycle, how to track and time things appropriately there. So some basics. The average menstrual cycle length is 28 days. Not everyone has a 28-day cycle. Certainly a lot of variability can happen there. It's considered normal if it's between 21 and 35 days. And there are two phases of the menstrual cycle: the follicular phase and the luteal phase, which is in the second half. And they're divided by ovulation. So ovulation is when the egg is released, and that is when we need the sperm and the egg to meet, or we're timing for that. So if you look on this image here, you can see day one is considered really the first day of your period. That on average lasts about 5 days. If you're here, you know how long yours lasts. And the follicular phase begins, which is when the follicles in the ovary mature and they prepare the egg to be released. And during that time, you can see a little bit higher levels of FSH, which is follicle stimulating hormone, and estrogen levels begin to increase. And then just before ovulation, which on a 28-day cycle tends to be around day 14, you see a surge in LH, which is luteinizing hormone, and the egg is released. And then progesterone levels start to increase. And in the luteal phase, this means the progesterone is helping you have a more thickened uterine lining, possible preparation for pregnancy, And if implantation occurs, meaning implantation of the embryo in the luteal phase, that'll happen usually between days 8 and 10, or 8 to 10 days after ovulation, but there's some variability there as well. And if there is no implantation, then progesterone levels fall and you shed the lining of your uterus starting your next cycle. That's a little rundown of basically what happens with the menstrual cycle. So, timing in the fertile window, so you can't actually get pregnant the entire time. The days that you can get pregnant are on ovulation day and estimated to be about the 5 days prior to that because of how long the sperm can live. And it's no longer really believed that there's much wiggle room after that, where after ovulation, they used to say maybe you had a window there as well, but it seems unlikely. So you can see sort of a general visual version of this where you have your period. Then leading up to ovulation, you can see the green dots, which would be your fertile window when you want to time intercourse. And then you have the dreaded 2-week wait where you wait to see if you had successful implantation and testing. So I want to also talk about some different ways you can track and different cues you can get to help determine where you are in your cycle. I think at this point, with the technology we have, if you're trying to conceive using an app to record your cycles, that should be kind of foundational. They're just so easy; they can adapt to you over time. But because it doesn't always predict ovulation perfectly, it's using a formula. It's not your body that it's really hearing from. It's just looking at the numbers. I think it's good to have at least one of these other mechanisms to give you additional feedback of where you are in your cycle. And you could do all three. So I'll talk about each one. So the first one is the LH strip, or an OPK. OPK stands for Ovulation Predictor Kit. Sometimes they are yes, no sort of answers of are you about to ovulate or not. Sometimes it's a gradient of determining where you are with that LH level that spikes right before ovulation. And you can see on that image up above that pink line is that LH that's spiking right before ovulation. And so if you can see how that level is increasing, then you can tell you're right about to ovulate. It's go time, and that's when you time intercourse. So the good thing about that too is that it's predictive, so you can tell it's coming, and it's not reactionary, or it's not. I'll talk about how temperature is more confirming that you ovulated. So anyway, the other good thing is you only have to do that for like 5 days of your cycle to kind of see your LH level rise. And the downsides of that are that some people end up limiting their themselves a little bit, where they're not using the entire fertile window. You have 5 days there, but if you see the LH strip isn't at its peak, some people will delay and they won't try until it's kind of right before ovulation, where you could be using those other days too. The other problem is that the LH level is best tested in the afternoon in a urine test. And so, depending on people's work schedules, it might be challenging to do this test in the afternoon, since it's between 12 and 3 p.m. and you have to wait 10 minutes. So you could have some problems if you're trying to do that in certain situations. Luckily, many people are working from home, and that made it a bit easier these days. So then another way you can test to see where you are in your cycle is your basal body temperature, or BBT. And this is because the first half of your cycle, your body temperature is about a half a degree lower. And then after ovulation, it increases. So that's that very top line, blue line on that graph above. And it rarely looks that clean. Usually there's a lot of variation in the temperature, and you're not going to see a super, super clear message from that. And that's one of the downsides. There can be some variability. There are different things that influence temperature, like alcohol, your sleep, the time that you took your temperature. And you do need to do it before you get out of bed and moving in the morning. But other than those cons, it is actually fairly easy to do. It's also inexpensive. You do need a special thermometer that goes to another decimal point in order to accurately test these minute changes in temperature. However, those are cheap. You don't need a fancy one. There are fancy versions like Temp Drop, which is a wearable, goes on your arm, and it records into an app, and it's very easy and people love it, but it's also more than you need to spend to get a similar result through a less expensive thermometer. So BBT can be great, but I guess as I did say, it is more about confirming that you did ovulate, so you can see that your temperature went up and that you did ovulate already. And over time, that can be sometimes easier for some people to tell what their patterns are, whereas other people, the pattern might be less clear, might be harder to interpret. And lastly, we have cervical fluid. Cervical fluid is basically your body's way of preparing for ovulation and making a more fertile environment. It actually helps with the sperm to get to where it needs to go. And so for some people, it is very obvious when their cervical fluid changes throughout their cycle. You might notice it when going to the bathroom, that you notice a change there. And right during that fertile window, it gets to be slippery and clear, kind of an egg white consistency. And so for some people, it's more obvious, or they are more aware of it, whereas other people, that might be a more difficult sign to detect. And so kind of whatever works for different people, I think it can be helpful, like as I said, for the base, to use an app, and then using some of these other ways to track your cycle can be help you kind of hone in on what your body's actually doing. All right, so move on here. Couple frequently asked questions about tracking and timing. One I get frequently is about the frequency of intercourse, and basically, you would target those days before ovulation. The day of and the 2 days prior to ovulation are the most important, but you don't have to have intercourse on all of those days. You can, some people wonder if they should be skipping a day or two to kind of load up, because that's what they do for a semen analysis to get a good, accurate reading. But you don't necessarily need to do that. In this case, it's all going to the same place. And if you're in the fertile window, you're good. So there are lots of different ways to do that, and there's not just one right or wrong way. And as far as when to test, I would just be cautious about using different pregnancy tests. Some are claimed to be more accurate than they really are from what the studies have indicated. So as hard as it is for people to wait to test, it really is probably better, because of false negatives and false positives that can happen. Trying to wait till your missed period if possible. All right, and so our next section here is on nutrition and supplements. So first of all, I like to emphasize just balance. This is not a time to be overly restrictive. You don't have to do, and many people shouldn't do, things like keto at this time. There are special circumstances, I'll say, when keto could be helpful, but in general, we want to target lots of healthy fats like nuts and seeds, olive oil, avocado, wild caught fish, and all that good stuff. Lots of vegetables. So I missed my putting a bullet here for that, but in general, Eating a higher number of plants, more vegetables, can help improve fertility rates. And I think part of that is they're anti-inflammatory. They have a lot of antioxidants, and for good egg and sperm health, you need to be combating oxidative damage, which can happen from life. All kinds of things can cause oxidative damage. Um, and so you need to balance that out with good antioxidants that keep things healthy. And so, and protect the DNA, for example. So lots of different colors, lots of different um, vegetables is good. And enough sufficient protein. So protein needs will go up in pregnancy in general, but you want to make sure you're getting sufficient amounts, which can vary by person and activity level. A lot of times I'm aiming for at least 70 grams of protein a day, and ideally through things like eggs, wild caught fish, unprocessed, grass fed animal protein if possible. And targeting complex carbs over like refined carbs, refined grains, and sugar. So you can have grains, but those slower to digest carbohydrates and the complex carbs from things like squash and sweet potatoes are more beneficial for a number of reasons. But one is it helps with your insulin response, so your blood sugar is not all over the place. When your insulin gets a little high and isn't, as your blood sugar is not as stable, sometimes you can have more inflammation. And there's, of course, pregnancy concerns we would think about too, or preventing things like gestational diabetes. So, in general, a lot of what you can do dietarily is it would be things that are good in general for you are generally good for pregnancy. Um, and so we'll talk in a little more detail about some specific nutrients as well. But first, I wanted to mention that eating organic can make a difference too. There are 3 studies I kind of mentioned here. The one in the larger quote is from Nature Reviews Endocrinology that was showing that new research suggests that the ingestion of pesticide-treated fruits and vegetables is associated with a reduced chance of pregnancy. Another study in the Lancet showed that men who ate organic had 43% more sperm than those who didn't. And the Earth study of 155 men showed that those who ate the highest pesticide fruits and vegetables had 49% lower sperm count and 32% fewer sperm that were shaped normally. So lots of reasons to eat organic, but on this note, I know eating organic for everything isn't possible or realistic for some people. So if you want to maybe target certain things that are more important to eat organic, I usually direct people to the Environmental Working Group. They have a list of the Clean 15 and the Dirty Dozen that changes, I believe, every year. And they choose the most pesticide laden things and say, get those organic, and some other things that are less prone to heavy pesticide use, and maybe you're not eating the outside of the fruit or vegetable that you could probably get away with not eating organic. So that's a good resource. Okay, so now some specific nutrients. There are many nutrients that we want to get when we are thinking about pregnancy and preparing for pregnancy. These are a few I wanted to highlight. Folate, I'm not going to talk about a whole lot because we know that that is good. It protects against neural tube defects. It's high in leafy greens, and it's in every prenatal and in sufficient amounts. So folic acid is the lab version of folate, and there is debate about how important it is to get the active folate called methylfolate versus folic acid. And I think it sort of, as much as it goes against some people's views, I think The research has shown that folic acid can be sufficient, but I think folate is a fantastic nutrient as well, and that is food-based, and you should target that also through food-based sources if whichever form is in your prenatal, it needs to be there. Um, the ones that have the box around them here, the choline, DHA, and vitamin A, I'm going to talk about those on their own slides. So a little note about glycine, iron, and B12. So glycine is interesting. It's kind of an unsung hero because it is an amino acid. It's the main amino acid that you find in collagen. And so you need collagen for yourself, but also for a growing baby, a growing fetus, for development of tissue and skin and everything. So glycine you can get from eating things like bone broth, as well as eggs and slow cooked meats and things like that. But that is a good nutrient to have. And as I move forward with this section too, I want to mention that I a lot of these nutrients it is better to get through animal proteins because they are in the active forms or they are in much higher amounts. And in some cases, you cannot get them from a vegetarian or vegan diet. Supplementation may be an option, but when I go through this, I don't mean to make it sound like you couldn't do a vegetarian diet. I work with people all the time and we do that, but there are certain nutrients that you'll notice there is an emphasis on the highest quality versions of those nutrients, and they tend to be animal proteins. So iron and B12 are some of those as well. So iron and B12 are common. It's common to see deficiencies in general. And so we want to make sure we're getting a lot of those, and those are primarily in animal sources. You can get iron through plant versions as well in dark leafy greens, but the most bioavailable form is in animal protein. B12 is generally only in animal protein and eggs, and some minor sources like nutritional yeast elsewhere, but those are some key nutrients we want to look out for. And so let's just move on to these next three nutrients on their own. So choline is a great nutrient, and some people feel that it is just as important as folate for preventing neural tube defects. And right now, our recommendation is at 450 milligrams per day, which is really based on limited evidence done years and years ago. More recent evidence has shown that as high as 930 milligrams, more than twice the recommended amount, can actually have better improvements in placental function. It can decrease the risk for preeclampsia and improve cognitive function in infants. We've found that high choline intake above the current recommendation is also more neuroprotective. There was a 2016 study in the Journal of American College of Nutrition that showed that 94% of women don't meet our current daily recommended intake amount of 450 milligrams. And one egg yolk, which is one of the highest food sources of choline, has 115 milligrams. So if you're an egg eater, you're much more likely to hit the choline requirements. And now you don't necessarily need to be at the 930 milligram mark, but I bring this up because even good prenatals don't typically have even the 400 or anywhere close to that amount of choline in them. So that's one to be aware of. DHA. So DHA is an omega-3. It is necessary for brain, eye, and neurodevelopment. It is found in things like fish. That is one of the best sources of DHA. And there have been studies on fish consumption like this one that I mentioned that has more than 12 ounces of fish per week during pregnancy was strongly associated with increased IQ and communication skills in the children. And it can also help prevent maternal anxiety by getting sufficient DHA in this time frame. And will also mention too that I talk a lot about these nutrients as if it is pregnancy, not only in preparing for pregnancy, because there are at least 2 weeks of pregnancy that, or really by the book, 4 weeks that you don't know that you're pregnant, because when you find out you're pregnant, you're already 4 weeks pregnant. It goes back to the first day of your period. And there is some important development that happens very early on. So I like to have people getting up their stores of nutrients before pregnancy happens, and really months before if possible. And we want to be set up so that when you do find out you're pregnant, you're already getting these good levels of things. All right. So the other last couple bits about DHA I wanted to mention was that you do get other omega 3s from plant based sources like ALA. But the problem with ALA in converting to DHA is that it's really inefficient. It only converts by about 3.8%. And so, though you can get ALA through plant sources, you're getting very little DHA conversion and you're not getting DHA from plant sources. And so, you can supplement with, if you are if you're going vegan or not wanting to consume fish, you could do an algae-based DHA potentially, or if you're open to fish oil supplements, you could get it that way as well. Anyway, any way you get it, if you're getting it from fish, I would want to aim for low mercury fish. In general, it's pretty simple to determine. The larger the fish, the higher the DHA because of bioaccumulation. So salmon is generally considered okay. Some of the larger fish, like tuna, you have to be careful with, and swordfish, you'd probably want to avoid that. But smaller fish, herring, and sardines and things like that are generally low mercury. Okay, vitamin A, I wanted to talk about this specifically because most people, if you have thought or heard about vitamin A in pregnancy, you may have heard avoid it because too much vitamin A can cause birth defects. And you do want to avoid high dose vitamin A supplements 100%. Like that's something we definitely want to avoid. However, there's a sweet spot because vitamin A deficiency can lead to malformation of organs. It can interfere with craniofacial development, and you need vitamin A to help with epigenetics, to help with gene expression. So even in the National Institutes of Health has said that pregnant women need extra vitamin A for fetal growth and tissue maintenance and for supporting their own metabolism. So we still want to make sure we're not getting a deficiency, which is actually most people. So one study showed that 80% of women of childbearing age in the US don't meet the RDI of vitamin A. And another study showed that only 1.5% of infants had sufficient retinol, which is the active form of preformed vitamin A. And preformed vitamin A, retinol, is found in animal protein like liver, eggs, and dairy. And you can get forms of vitamin A like beta carotene through orange fruits and vegetables, but there are some problems with conversion and how your body handles that, where the retinol form tends to be the best form. So what I do is I usually look at people's diets, how much they're getting from that, and their prenatal, and we kind of hone in on what the optimal range would be that gets them clear out of the deficiency range, but also keeps them well out of the excess range as well. All right, and so therefore, supplements really vary by individual needs. The prenatal is great. Everybody should be on a prenatal that is trying to conceive. And in some cases, depending on your diet, there may be room for additional supplementation for those nutrients that I mentioned, like choline, omega-3s, or DHA specifically, vitamin D or iron if we test and see any issues there. Not everybody needs to be on an iron supplement, though it is common to see an iron deficiency in general, but also in pregnancy, it increases. And then there are certain supplements that can be beneficial to help improve ovulation or embryo quality. And these I don't have everybody take. They're usually for certain reasons that I would have somebody take any of these. NAC, CoQ10, inositol, L-carnitine, and DHEA. For the most part, they are very well tolerated, but you don't need all of them. For not everybody needs all of them or any of them. And the DHEA is one that you do really want to be careful about the dosing because it can impact your hormones and increase things like testosterone. So those are really a case by case basis overall. So one of my favorite resources to provide people about nutrition and pregnancy is Real Food for Pregnancy by Lily Nichols. I have used some of her stats already tonight in some of these previous slides on nutrients. She's a wealth of knowledge, and this book is fantastic. It's a really great modern take on nutrition and very evidence-based. She also has a book specifically for gestational diabetes as well, though this book itself would likely prevent a lot of gestational diabetes issues as well. Moving on to environment and lifestyle. So these are some basic lifestyle factors when you're trying to conceive. No smoking. Alcohol is a little complicated during this time frame. Moderate is probably the most you'd want to be drinking during the first half of your cycle because which can vary a little, but it could be as much as 7 to 10 drinks per week is considered moderate. And during the second half of your cycle or the 2-week wait, I generally recommend either none or just very little because you could be pregnant during that time. There's a lot of debate about alcohol and pregnancy right now, and most people are just erring on the side of caution, saying there's no consensus on the amount that's guaranteed harmless in pregnancy. Not a lot of benefit you're going to get from it. There are other ways to wind down. And so that is generally what is still recommended is at least the 2-week wait and after to avoid it. And part of that I'll touch on is some of the studies that were done on alcohol that kind of started some of the recommendations or really emphasized them were done in a peculiar way where the alcohol group also had a lot of heavy cocaine use. And so it's quite the confounding variable where it's more like drug use is bad in pregnancy. That's what we got from that study, really. And there have been a mix of studies since then that where some have shown maybe there are problems with as little as what's considered mild alcohol consumption, which is actually like 1 drink per day, or just under that. Like I think it's actually 6 drinks per week, whereas other studies have shown no harm at that level whatsoever. So it still kind of comes back to the same conclusion. There's no real consensus about the amount that is guaranteed to be harmless. So better to err on the side of caution. Caffeine, you want to limit that in pregnancy generally to under 200 milligrams of caffeine per day, which is a couple cups of coffee. Um, and there's some evidence that that same recommendation would likely be good for trying to conceive. And exercise, this is individualized. I definitely think so exercise, yes, you do want to exercise if you can. And the specific variations on that are going to vary by individual and how strenuous that is. You don't want to be doing things that are overly strenuous, that is stressing your body too much, where your body um, may decide it's not an optimal time to conceive. However, that depends a lot on the individual. There are people that are already doing a lot of exercise, and that is not causing them any problem with conceiving. So it depends on the person. I think in general, I try to recommend a mix of cardio, weights, and stretching or yoga, but it's really about being mindful of the extremes with that. And stress management is a big category too. I've heard from a few places, I don't know what the original source is, that people struggling with infertility can have stress levels comparable to those that have received a cancer diagnosis because you are so stressed out and every month it is stressful and you might be going through a lot of procedures and testing and all that. And it can be incredibly stressful. Um, but even if you're not at that point in your trying your conception journey, it is still important to try to manage your stress because that can impact fertility. Whatever that is for you, if it's, making sure you are exercising, if it's getting outside and walking or having some meditation or yoga practice in your day. If it's acupuncture can has some mixed studies on fertility. And I think it could likely be more beneficial for people that do find that as a stress relief as well. Um, so yeah, lots of good stuff there. And so the other part of the environment and lifestyle factors I wanted to talk about is endocrine disrupting chemicals. So endocrine disruptors, these are chemicals that are ubiquitous in our environment that can mimic hormones. They can impair the production of hormones and interfere with signaling. And there are lots of different studies in different endocrine disorders and fertility and how endocrine disruptors can affect those things. Increased risks of miscarriage and infertility and all kinds of stuff listed there. Common endocrine disruptors include phthalates, parabens, PCBs, bisphenols like BPA, PFAS, and heavy metals. And as I said, they're found everywhere. They're in food packaging, in plastic water bottles, furniture, pesticides, cleaning products, makeup, personal care products. Um, I read there's a few studies that have tried to quantify the amount of chemicals that we're putting on our bodies every day, especially women. And one study estimated around 168 different ingredients from personal care products. Another one was 515. And so I think a lot of people fall somewhere in the middle for 200 chemicals applied, synthetic chemicals oftentimes, uh, whether it's lotions or makeup or hair products. They truly are everywhere and challenging to avoid. On the next slide, talk about ways you can do that. You don't need to do everything all at once. You don't need to do everything at all. It's impossible, as I said, to avoid them all, but we can try to reduce our exposure. And so starting to make swaps, like swapping out a plastic water bottle for a glass or a stainless steel water bottle, can be a good, easy first step. Try not to microwave in plastic, or even dishwashing in plastics can create an environment where the plastics are more likely to be broken down and more likely to leach these chemicals into your food later. avoiding hot food and plastic, which makes it difficult to order certain things at takeout restaurants. It can it can pose interesting challenges there, but it's hard to do it all. It's hard to avoid them all. Eating organic, as we talked about before, trying to avoid handling receipts because the paper that they use actually has BPA that is easily transferred through your skin just by handling them. Obviously, if you do that for your job, it can be a challenge, but being mindful of that. Avoiding nonstick cookware. What I like to say here is obviously I wouldn't, it would be an expensive endeavor to try to swap out all of somebody's cookware if it was all nonstick. But if you have a pan that you use very frequently, trying to make sure that one is a better, less endocrine disruptor laden cookware option. And some options for that would be stainless steel, um, a cast iron pan, and ceramic. But just be careful with ceramic because some of those are now have a coating on it themselves, but some of the ceramic are okay. And starting to swap cleaning and personal care products. So if you're buying something new or it's something that you're using every day, you might look into alternatives. And also just simply taking off your shoes when you enter the house because you could be tracking in pesticides from the lawn and different things when you do that. So it's an easy thing to reduce the spread of those chemicals throughout your house. And this slide offers a few great resources for helping with those types of things. Countdown is a great book by Dr. Shanna Swan. I think this was released a little over a year ago, maybe, and it is really good at looking at the environmental exposure and how that's affected fertility. I think it's a little bit nerve-wracking in some ways because of just how these chemicals are everywhere and how they really the studies do show how they can affect our reproductive systems. But it's also empowering. I think it's knowledge is power, and it's a great resource. The Environmental Working Group and their Skin Deep site are also great for looking at ingredients or um, products as a whole to see if they have a lot of endocrine disruptors in them. That's one of my favorite sites and resources to send people to. And the other resources are also great, but those are the top two are where I would start. Okay, so we've talked about male fertility kind of throughout, but I wanted to touch on a few special things for men because male factor infertility can account for as much as 40%. A lot of my female patients that have been going through infertility or preconception care like to take or they may not like to, but they tend to take on all of the responsibility for um, getting themselves ready for conception, and they tend to blame themselves if things aren't going right. And so it's important to talk about just how much men's fertility can matter. And it's an unfortunate myth that to think that men's fertility doesn't wane over time or that they're less likely to be the problem because they are a major factor here. So some other lifestyle basics for men. Avoiding hot tubs or prolonged heat near the testicles is important. That heat can damage sperm. And we also want to be mindful of long bike rides or things that might compress the blood vessels leading to that area. I do think there's some room for interpretation here depending on the bike riding scenario. I think it's different to be on a Peloton for certain or like an at-home bike for a period of time versus a 30-mile bike ride outside, and how you might be moving on a bike could vary somewhat. But anyway, something to be mindful of. Stress management and sleep. A lot of men take on quite a bit of stress, and that can impact fertility. So, finding the same kind of ways I talked about before for helping dealing with that stress. A lot of the nutritional recommendations I talked about before also apply for men too, but some other specific nutrients that can be helpful for men are selenium and zinc. And you can get selenium by eating Brazil nuts. It's one of the highest concentrations of selenium. And zinc is in things like oysters and pumpkin seeds and all kinds of good stuff. They should also avoid endocrine disruptors and no smoking. And for men, it appears that moderate alcohol consumption doesn't appear to impact fertility. Um, and so if he's having a glass or two a night, it will likely not be impacting fertility, but I do think there's something to be said for solidarity, and there can be other health benefits to reducing alcohol consumption as well that should not be overlooked. All right. And so supplements for men, this is going to vary on individualized need. This might depend on a nutrient deficiency, or um, if he has a semen analysis come back or labs that come back that are abnormal. Some of the things that I think about would be CoQ10, which is one of the main kind of powerhouse nutrients that has some studies on things like sperm concentration, motility, and morphology, which are other parameters we look at in a semen analysis. But those, not all men need to be taking all of those or any of those necessarily. It depends on their need. And labs and imaging. So this is the last few sections here, or last section, last few slides here. Okay, when to start testing? Get this question a lot. You may have heard that conventionally they tend to start after 1 year of trying to conceive. And I think it depends on the couple, it depends on the age, health conditions, and for many of these tests, you can start looking earlier. That is not a problem. Um, and especially if there's another reason to try testing earlier. Lots of different things can impact fertility. So I like to start having this conversation, start looking at some of these things earlier on, so we can get things on the right track sooner. Some of the women's labs would be like day 3 baseline hormones. That's a pretty basic start, a good start. And then building on that, looking at thyroid, metabolic panel, like blood sugar and liver and kidney function, making sure there's no anemia or subclinical issue, or maybe iron deficiency that might not show up on a CBC. Blood sugar regulation, if there's other reasons or if indicated, we might be looking into other markers like insulin levels, B12 and folate, homocysteine. If I'm suspicious of celiac disease, that's something that if it's undiagnosed can impact fertility. And in some cases, I might refer for an HSG, which is either performed by an OBGYN or a reproductive endocrinologist. And that is what is pictured here, where they are looking to make sure your tubes are open. And the good thing about that is that it also helps clear your tubes, making sure the egg can get down the tubes, and the sperm can get to them. And fertility centers often do some genetic testing as well. For men, semen analysis is a good start, but also looking at some hormones for them as well, making sure testosterone levels are adequate. Physical exam can be done to look for structural factors like a varicocele, which is a blood vessel that becomes enlarged, and it can potentially impact the sperm in the semen analysis. And in some cases, men might need a ultrasound if there's nothing that's coming up on physical exam, that or there's some suspicion there might be more going on. And in some cases, you could consider what's called a DNA fragmentation test. DNA fragmentation tests look at uh, if the sperm DNA is fragmenting. And so if that is not something that shows up on a semen analysis, but you can have a normal semen analysis and have an abnormal DNA fragmentation test that could impact fertility. It's not done routinely, but it is a newer test, and it it's usually a little bit expensive, but there are reasons to consider doing that as well. So yeah, those are some of the factors there to look at. And so, in summary, preconception care is more than a prenatal. There's a lot you can do. There's a lot you can do well, even leading up to trying to conceive, that can help optimize things. And it can help increase your chances of conception and help support you in your body and your baby as you move through pregnancy. So that is it for my presentation. Thank you for hanging with me tonight. And if you are interested in learning more, becoming a patient, or having a visit if you're already a patient, to talk about how these things might apply to you specifically, or kind of get the ball rolling with this, I would love to see you. Our number is there, and I think after I close this presentation, you'll have an opportunity to sign up for a free consult with one of our team members to ask any questions you have about our process. So anyway, thank you and have a good night.